we have a case notes here. By quickly going through the case note, we can see that there is a heading of patient history, then there is a visit on 10th of September 2014, followed by another visit on 12th of September 2014, and after that there is a third visit on 15th of September 2014. And we quickly go to the writing task. They mentions using the information given in the case note, write a letter of referral to the admitting officer at the emergency department, Newton Hospital. So by looking at the writing task, we can see that we need to write a letter to the emergency department, so that there must be some emergency. So it's kind of an emergency referral letter. So by establishing the idea that we need to write the emergency referral letter, the first thing we need to come in our mind is the sequence we just remembered. So that in the emergency referral letter, we need to write like the sequence is first the purpose statement, followed by the last visit, followed by the first visit, then subsequent visit, and followed by the past personal family history, and at the end the closing. So that thing we need to keep in mind while constructing this letter. First of all, we will write the date. So in the case note, we can see that there is no mention of that date, that you need to write the letter on this date. So we will use the last visit date, that is on 15th of September 2014. We will write as 15/09/2014. That's the exact format of the date we just established. After that, we will write the admitting officer, because in the case notes we can see that they are asking us to write a letter to the admitting officer. So the admitting officer, we mentioned that. After that, we will write the emergency department. After that, there is a comma. So the rule that whatever comes after the comma we will write in the next line. So we will write Newton Hospital in the next line. After that, there will be the dear doctor statement, and in this case we will not know the name of the doctor. So what we will write if we don't know the name? We will write dear sir. If we know the name of the doctor, we will write dear Dr. Shaw or dear doctor, whatever the name the doctor has. But here we don't know the name, we just need to write the letter to the admitting officer. So we will write dear sir, comma. So we have done that. After that, we will write the regarding statement. So the regarding statement are small e, colon, and Miss McConville, comma, 38 years of age. So in the case note, we can see that the name of the patient is Sally McConville. And I already told you that if there is an adult patient, we need to write the last name, and we will use Miss or Mr. Before that. So we just simply write Miss McConville, comma, and the age is 38. We will write 38 years of age. Next, we will write the purpose statement, and we have that purpose statement template for the referral letter in our mind, that we will write here like, I am writing to refer Miss McConville, comma. Those features are suggestive of. So first we cross check that either the general practitioner is confirmed about the diagnosis or not. So we can see that there is a question mark before the pneumonia, so that the doctor is not confirmed about his diagnosis. So we will use the word suggestive of. So we will write here as, those features are suggestive of pneumonia under your care, comma, for further management. This way we have completed our purpose statement by keeping in mind the free template I just provided you earlier. Now we will write the purpose expanded thing, and to write that thing we already have a thing in our mind that we will use the sequence as, first we will mention the last visit, after that the first visit, then subsequent visit, and at the end we will write any personal or history, followed by the closing. So by keeping that framework in mind, we will write about the last visit. If you look at the case of the last visit, it goes like, history has more shortness of breath today despite prednisolone and antibiotics, feeling feverish and unwell. Examination, short of breath at rest, respiratory rate, blah blah blah, and we have all of the information regarding that. So now we are going to construct that in the form of a paragraph by having a normal idea that how to construct a paragraph. By first you write the presenting complaint, followed by examination, followed by any radiological finding, followed by the blood test, all of the framework I already told you. So we will write here as, on 15/09/2014, comma, Miss McConville presented with worsening shortness of breath despite taking prednisolone and antibiotics. Now we will write about the examination. Examination revealed that she had fever, tachypnea with obvious use of accessory muscles. So we just converted those information in the examination section into a statement. There was a widespread wheeze with bilateral basal crepitations, acute exacerbation of asthma was suspected, and a provisional diagnosis of pneumonia was made. She was prescribed a Ventolin inhaler, however her condition did not improve. So you can see that whoever wrote at the first he used the word but we need to use however. So there are some rules about the English grammar that you need to remember. I will provide a PDF to all of the grammar rules. There are like 100 rules. Just you need to go through that PDF once and you will memorize all of those rules. The rule that if there is a patient less than 12 years of age, you use the first name. If the adult, you use the last name. This rule is also mentioned there. So there are a lot of rules. Whatever the rules you need to know to write a letter, they will be mentioned in that PDF. So you just quickly go through that once after this video and you will be good to go. Now let's construct the second paragraph. That will be our first visit. So on 10/9/2014, Miss McConville first presented with a complaint of runny nose over the last 2 days, fever and productive cough. So whoever wrote at the first runny nose for 2 days. There is some grammar rule involved here that you need to write over the last 2 days if there is some indefinite period of time, not for 2 days. So by going through that grammar rule PDF, you can easily get that mistake correct. After that, examination revealed a scattered wheeze on the chest and inflamed throat. A viral respiratory tract infection or infective exacerbation of asthma was suspected. She was prescribed Ventolin inhaler and continued fluticasone. There is another mistake mentioned that you use small words in the start for a generic name of the medication. Fluticasone is a generic name, so you use small f. As her asthma was previously well controlled on it, we have successfully constructed the paragraph for our first visit. Now just quickly go to the subsequent visit. The next visit we have is on 12th of September. We can either write the next paragraph as on 12/9/2014 or we can write as on subsequent visit. Both of the things will be correct. So we write here as on subsequent visit, Miss McConville. Here you can see that mention presented corrected by attended. So we need to keep in mind that we need to keep changing words. I already gave you a list of different alternative words. Here we will write Miss McConville attended with increasing shortness of breath and dyspnea on minimal exertion. This will be the presenting complaint in the start. On examination, there was a widespread wheeze. However, no crepitations. After that, infective exacerbation of asthma was suspected and she was prescribed amoxicillin and prednisolone. Again, amoxicillin is a generic name. We will use the small letter as A. So this way we have successfully constructed the paragraph for our subsequent visit. We will write the past personal history in the paragraph like Miss McConville has a past medical history of asthma and hypertension. She has been taking gamipril, paroxetine, fluticasone and Ventolin with no allergies. So that's the best possible way we can concise the information that is mentioned in the case notes. Now we just need to write the request and to close the letter. In the request we will write as it would be appreciated if you could take Miss McConville under your care. The request is like that, and the closing statement will go like please do not hesitate to contact me if you have any queries. After that you see that there is mentioned yours faithfully. As I already told you, if you know the name of the doctor you write yours sincerely. If you don't know, like the admitting officer, we don't know the name of the doctor, we will write yours faithfully, and then you will skip 2 lines and you will write doctor. This way you have successfully constructed another urgent referral letter as well.